I let it fall, my heart, and does it fail?
So, Dr. Neal, what are the first symptoms that a person can determine if they have melanoma or not?
Well, oftentimes there are no signs. Sometimes it's a mole which has grown or has become itchy. Also can have uneven circumference. The edges are a little bit ragged, something along that nature.
Oh, okay. So, after a patient has been diagnosed with melanoma, do they have a follow-up, or how do you go about treating it?
Well, just to make sure, they have to have some labs done to test whether that area is cancerous or not. So they have a biopsy. Oftentimes it's so small, if it's a small mole, they can do a punch biopsy right then and there pretty much.
Okay, thanks.
You want-
So, Dr. Neal, do you know anyone or have any close relatives who have had melanoma or been diagnosed with skin cancer?
I do, actually. My own mother. She had one on her nose, and well, it was a kind of by her cheek and her nose, and she knew it was something strange, abnormal, because the bump kind of grew. It looked like a pimple at first, then it started to really itch, and she said it felt like something, it was just moving. It felt almost alive, kind of a little bit weird, but that was her explanation of how it felt. So she went to the dermatologist, and they actually did a punch biopsy, so right there, and then they
So
found
she
out.
did get it removed.
She did have it removed, yes.
Okay.
Indeed, yeah. But she goes every 6 months now to get a follow-up to make sure it hasn't returned.
Has it?
Nope.
Oh,
It's all good and clear.
that's good. Good to
Yeah.
hear.
Yes, thank you.
So, do you know what causes melanoma?
Well, oftentimes, it seems like more times than not, it's through the sun for UV rays. That's why it's really important to put on some sunscreen with a high SPF. But 50 to 70% of the time, it's through mutations.
Oh, okay. So, a human's or a person's genetic, traits. So, certain people, are they more susceptible to developing skin cancer?
Yes, they are, actually.
Okay.
So that's something people have to take care of and be careful with. And it's good to get like a mole checkup, maybe once a year or so.
So, you mentioned something about mutations that can cause skin cancer. What are those mutations that you're talking about?
Well, there's the BRAF and the MCR1 mutations. They're the main ones that cause skin cancer. The MCR1 gene provides instructions for making a protein called the melanocortin-1 receptor.
So, what does the receptor do exactly?
Well, the receptor plays an important role in pigmentation.
Oh, okay. So, you mentioned another mutation. I think it was the BRAF. So, what does that do?
That was correct. With the BRAF gene, it eventually causes the body to have too many cells by constantly making more, which offsets the entire system of the body.
Okay. So, what are there any treatment options?
Well, of course, in cancer, there are 4 stages, and in the first 2 stages, people usually are able to get a biopsy and have it removed. But in the later stages, treatment options are immunotherapy, radiation, and chemotherapy.
Okay.
Melanoma has plenty of stages. It's so dangerous, it should be locked in cages. It can be deadly disease if you don't get help. If you want my dermatologist, just yelp. With this disease, you sometimes can't really hear it. Aside from skin, many symptoms aren't apparent. From a darkened mole to a red patch, if you have one, make sure you don't scratch. Melanoma is caused by harmful UV rays. The disease gets progressively worse each day. Go see your doctor if you're not feeling okay. The sun is not the only contributing factor, though. Melanoma can be caused by mutations as well. Let me tell you about a main one of them. The BRAF gene can cause melanoma. Yes, it can.